Now, ankle arthritis is common and can be very debilitating because every time you take a step, it can cause pain. This is most commonly caused by trauma, often years before, and this can be injury to the ankle ligaments, which makes the ankle joint unstable and can lead to osteoarthritic changes. And it can be caused by trauma to the cartilage and bone inside the joint during, say, an ankle sprain or a traumatic incident. And whilst the ligaments remain intact and fairly healthy, the inside of the joint is damaged, and often that isn't picked up until it's too late. Sometimes ankle arthritis shows itself 10 or 15 years after the initial trauma that caused it, and things like an increased body weight and being underactive tend to exacerbate that. Now, there are things we can do conservatively to help with this, and that might be a case of looking at shoes, footwear, insoles, and most commonly for me is do either a mixed injection of corticosteroid and hyaluronic acid. This both takes away some of the painful symptoms of the arthritis, but also lubricates the joint, prevents some of the grinding that causes the pain in the first place, and that injection can last a good year and is then often safely topped up every 6 months or every year. The idea being we're trying to avoid the surgical procedures that have a bit of a mixed success, most successful of them being a fusion operation. If we catch these ankle injuries early, we can do a platelet-rich plasma injection. This is an injection we take some blood, filter out the growth factors and platelets, and then inject them into the injured tissue. That might be into the joint space where the cartilage is, and can be to the ligaments. And this as well speeds up the recovery process, it speeds up the healing, and may prevent some of the worsened arthritic changes further down the line. And I found it clinically that's had a really, really good success in the younger age groups, and less so as people get older.